Professionalism plays a large part in what we do. We try to live out our professionalism every day as far as, the way we look, the way we talk to patients and their families. Eye contact, what I like to do every day is sit down beside my patient. If they allow me to, touch them so that they know that I'm there for them, and just ask them, what is it that I can do for you today that hasn't already been done? Some of the things that our unit has done, as well as hospital-wide, we have huddles in the morning so that we can celebrate our accomplishments daily. We go over what hot spots we have, like if we know that patients are at risk of falling, because safety is one of the goals that we keep at the forefront. We go over hot spots. We go over anything new that's happening on the unit, name alerts, basically focus on our patients. But we do add some things in there so that it brings us together as a team. The purposeful rounding really helps because we've instituted the primary nursing, which the nurse that admits the patient or is in contact with the patient for the first time, they are able to find out what the patient's story is. And that is communicated to the nurse that's following them. So the story doesn't get lost, because a lot of times in communication you forget what's most important to the patient, such as, I like French toast for breakfast. So we try to do some of those things that are patient-centered. The identifiers that we have in place, such as the patient's name, date of birth, when you pass your medications, that lets our patients know that we're doing the best we can to take care of them, because we're trying to eliminate mistakes. We try to explain to them what we do, why we do what we do. And I think that our patients are more receptive when they're, when we explain things. I think a professional caring environment allows families to relax and know that the nurse or the team is going to care for their loved one once they're gone. I think the nurses try to be as visible as they can. We have instituted the hourly rounding so that we can catch those family members as they're coming in and out. So if they don't know our name, they know our face. And we have boards in our room that have our names and that on there, and I think that just encourages relationships with our patients. Our hospital does send out surveys so that staff can get feedback as to how we're doing, and I think that really helps us to know that we're going in the right direction. And of course we welcome negative feedback as well as positive. We don't necessarily focus on the negative. We take positive and we run with it. So if we're doing something great, we try to build on that, and we try to celebrate those things as much as possible on our unit. I think one of the things is to smile, to talk directly with your patients, sit just for a few minutes, just take a little time to sit with your patients and talk with them. I think that's one of the most important things that you can do. I think we just need to continue to strive for excellence in our daily work and our dealings with our patients and their families.